everyone. Our lines are open here. We're going to try to get to everybody, so hang on tight. Our number here is 602-277-5369, and toll-free it's 1-866-536-1100. We're speaking with Dr. Dean Silver and Rachel, what is it? What?
Margalie.
Okay, thank you for saying that for me. Doc, you have been doing this for 35 years. You're a cancer survivor.
Yeah, in 2000 I had a lymphoma, which is a cancer in my lymph nodes and my chest from years of fluoroscopy, and I want to let the audience know that we can now measure circulating tumor cells, and my result came back last week, and I'm completely clean. There's no cancer in my body. It's kind of incredible.
It's incredible. Now, I want to get to some of these callers that
Surely.
are calling in. We were talking pain, but it doesn't matter what you want to talk about. Any ailment that you've got, you can call in and ask questions and get some free advice right here. 602-277-5369. Toll free, it's 1-866-536-1100. Mike, you're on the line. What's your question?
Yes, I have numbness and tingling into my pinky and ring finger, and they want to do a nerve conduction study to rule out a nerve problem. I was wondering if the ultrasound would be a better test.
Well, let me tell you a case Rachel and I had last week. We had a gentleman just like you. He had pain down his arm into his hands. And Rachel was able to show me the nerve as it came out of his neck. And around the nerve it was swollen, so you could see the fluid in there. And with her help, we injected in the nerve that was coming out of the neck in several spots. And he called me up the next day. He says, "Doc, do I need the MRI? Do I need any other studies?" I said, "Well, your pain's gone." He said, "Yeah." So we've seen some fabulous results. Now, I'm not telling you not to do what your doctor says. Of course, you got to file. You know, I'm not your doctor. I don't know your case, but sometimes we can actually see. We can do some injections like this. An ultrasound is a fraction of the cost of MRI. I don't know if you have insurance or not. And hopefully we can help you. Like what do you think, Rachel? Remember the guy last week?
Yes. Mike, do you have any pain in the elbow, along the inside of the elbow by any chance? Is it sensitive there?
Exactly, Rachel. That's exactly where my elbow hurts, in the inner part of the elbow, and specifically my pinky and my ring finger are numb almost all the time.
It sounds like, from my perspective, and I'm a technician, not a doctor, but that the ulnar nerve, which runs down the medial elbow, could be compressed. The ultrasound is fantastic to pick up things like that.
That's exactly what they were thinking, ulnar nerve, but they have me scheduled for this nerve study, nerve conduction, where they're going to be sticking needles up and down my arm, and I was hoping to find a better alternative to that, if possible.
Well, we could visualize that nerve and do some injections and at least get you out of pain. But again, I would talk to your doctor.
I'm going to connect you with him, Mike. I'll tell you something. Anytime that somebody's going to be sticking me with that many needles at one time, I'm going to want to get a second opinion. I mean, it doesn't take anything to go in there, have him check it out. You go on the ultrasound and he'll know exactly what to do. Dr. Dean Silver, he is a doctor, and he has been doing this for 35 years and in practice. His number, it's area code 480-860-2030. I'm going to get you connected with him right away. When is that MRI that you're supposed to have?
Well, it's a nerve conduction study, not an MRI.
Well, when is it?
For Thursday of next week.
Cancel it.
Well, wait, don't cancel it. We can see you on Monday. Rachel, I can see you, and we can give you another opinion.
So yeah, that's it. It's another opinion. Thank you very much for the call. And I was only kidding, but anyway. So our number here is 602-277-5369. Toll free, it's 1-866-536-1100. Pain related, cancer related, we want to hear from you. Doc can help you. He can give you some free advice right here and help you decide what maybe you should do. 602-277-5369. Toll free, it's 1-866-536-1100. A lot of men today calling in. Maybe we've got a woman to call in too. So women have pain.
Absolutely.
We were talking a little bit about we were talking a little bit about cancer during the break, and how people who are they do chemo and all sorts of things that they've been taking, and they're in a ton of pain.
Yeah, pain is a big problem. Cancer itself is a big problem. We address all that in the office. We do nutritional IVs, we do ozone, we do vitamin C drips, we do glutathione. So anybody out there suffering from cancer, and we can also give you alternatives. We can find out how to kill your cancer.
But you also believe in medicine if you have to, really?
Oh, absolutely.
Right. I want to get that out.
Yeah, I use low-dose chemo, but I find out what chemo to use. We do a test from Europe that actually tells me what chemotherapy works in your cancer, because all cancers are different.
Our lines are on fire. We're going to try to get to everybody here. The number to call is 602-277-5369. Dean, you're on the line. What's your question?
Hi, thank you for taking my call. I have a question in regards to a sports-related injury that I had years ago. I had surgery on my shoulder, and there were some metal clips put in there that I'm having some recurring problems, and I think I may need another MRI, but obviously with those clips in there, I'm not going to be able to have it.
Yeah, well, you see,
I've really
with ultrasound, we can do that. Obviously, with MRI, if you have prosthetic hardware pacemakers, the clips like that, bullets, we can't do that. But what do you think, Rick?
The ultrasound is so great at differentiating between bone, surgical hardware, calcification. It can pinpoint exactly any artifact, foreign body.
What problems are you having, Dean?
I'm having trouble with the range of motion. I was okay with it, but I think I re-aggravated it, and I've just been dealing with the pain, and they pretty much ruled out me even getting an MRI because
Yeah, no, we can help you. We can help you.
Let me give you
no
the
one's
number.
ever mentioned the ultrasound
Yeah.
to me, which I found to be a bit unique that it's even come up. I've never heard about it.
And Rachel's the best. She really is superb.
Let me give you some information, Dean. It's 480-860-2030. Check him out on his website. It's Dean, D-E-A-N, silvermd.com, and we're going to get you connected with him. Don't you worry about that. Thanks for the call. We're going to go right into our next question because we don't have much more time. Joe, you're on the line. What's your question?
I've got glaucoma, and I've had it for about 15 years. I was wondering, do you have any ideas of any nutrients or supplements that might help?
Sure, we use macular supplements as well as supplements to lower your interocular pressure. I've been on vitamin supplementation myself for 15 years now. So basically that is free radical damage, and that's got to be eliminated. And with the proper antioxidants and the proper eye health, we can help you with that. We also use I use photon therapy, magnetic therapy, so there's lots I can do to help you lower the pressure. My patients' pressures always come down when I supplement them. And I would probably give you the same supplements that I take, or I mean my mother, and she's 90 and alive and well.
Thanks for the call. We're going to get you connected with him as well. We only have a few more minutes, but we're going to let the lines keep on open here. So if you have any questions, give us a call here at the station, 602-277-5369. And toll free, it's 1-866-536-1100. For the last few minutes, what do you want to talk about? Anything.
Let's talk about why we age and what we can do to prevent it.
Oh my God,
How's that
yes.
sound?
I like that.
Okay, the reason
I've
we
been
are...
looking at myself in the mirror all day today.
Okay, well, the reason we get old and our blood pressure goes up and our cholesterol goes up and our bones get weak and our hearts get blockages and our memories go bad and our hair gets gray is this stuff called free radicals. Free radicals, okay? So basically, it's a fire that's going on in our body. And the only way to squelch those free radicals is to, number one, measure them, and number two, squelch them. And the way to do that is with
How do you squelch them?
With antioxidants.
I wanted to say that.
So you like that word, squelch?
I like the word.
And we can measure that in the office. And for most people, insurance pays for this study. So the take-home message today is you can slow down the aging process. You can prevent and lower your free radical load so you don't have all the miserable diseases that I had in my life, number one being cancer. So cancer itself is free radical damage.
So squelching the aging process is by getting rid of the free radicals?
Exactly, with antioxidants.
How do you do?
With
Okay.
antioxidants.
And so antioxidants they can do in a supplement form?
Yes, we use several different pharmaceutical-grade vitamins that I put together myself 15 years ago.
Well, Doc is located in Scottsdale, just north of Shea. His phone number is area code 480-860-2030. That website is Dean, D-E-A-N, silvermd.com. And if you have any questions, you want to get connected with him, we'll let you call in for the next 5 minutes and call the station for him, 602-277-5369. You're going to be coming back on again soon.
Yes.
And I'll tell you something, I absolutely love Dr. Dean. He's been fabulous and helps a lot of the people out there. Again, his number is area code 480-860-2030, and that website is Dean, D-E-A-N, silvermd.com.